In this video, I will teach you what to do if you see someone collapsed. The initial assessment is called a primary survey. This is the quick or early assessment to establish how to best treat our casualty in order of priority. We can use the code Dr. ABC to remind us the steps that we need to follow. These initials stand for danger, response, airway, breathing, and circulation. While checking responsiveness, we use the ABPU scale to assess the casualty's level of response. These initials stand for alert, voice, pain, and unresponsive. When you see someone collapse, at first you have to check for any danger to be sure that it's safe to approach them. Then your next step should be to see if the casualty is responsive. Kneel down beside them, gently shake their shoulders. Then ask them questions and introduce yourself. You can pinch their earlobe to see if they're responding to pain. Depending on how the casualty reacts, you will establish a level of response. If the casualty is still unresponsive, open their airway by putting one hand on the forehead and gently tilting the head back with 2 fingers under the chin. Then place your ear and cheek over their nose and mouth for 10 seconds. Look down the casualty's body of their chest rises and falls. If the casualty is breathing normally, we will check their blood circulation. Look and check down the body. Complete each step in an order as quickly as possible.
When you see someone unconscious, first check if anyone's around and if there are people who can call 112 or 911 for you. If not, call them yourself and put your phone on speaker. Then, start performing the primary survey. If the person is unresponsive and is not breathing normally, start CPR. When applying CPR, you should be careful that you press down on the chest 5 to 6 centimeters and that your hands don't look like this. Instead, they look like this. Repeat this to give 30 chest compressions at a rate of 100 to 120 beats per minute. To help you keep pace, you can sing Staying Alive. After 30 chest compressions, you need to give rescue breaths. And to do that, you need to open the airway by tilting the head back and pinching the soft part of the nose to allow the mouth to fall open. Then, seal your lips around their mouth and give 2 breaths in about 2 seconds. Continue to alternate 30 chest compressions and 2 rescue breaths till help arrives.
If you suspect that someone is choking, first you need to check if the person is breathing. If the person is still coughing or cannot speak, you should give them up to 5 back blows. Remember to check after each blow. If it fails, clench your fist and stand behind the person, then place your both arms around her body. Make sure to lean them forward. Place your fist between the navel and the bottom of the bone. Grasp your fist firmly with the other hand, then pull sharply inwards and upwards up to 5 times.